Have you ever read a superhero story where there's a villain hiding in the shadows, one that looks like a friend but slowly harms everything around it? That's kind of what cancer is in real life. And the heroes who fight this silent villain, they study a field of medicine called oncology, the science of understanding and battling cancer. So today, let me tell you what oncology is, why it's super important in medicine, and how doctors, nurses, and scientists use it to save millions of lives. What is cancer, and why does it matter? Let's start simple. Inside your body, you have trillions of cells, tiny living units that grow, divide, and die when their job is done. But sometimes a cell goes rogue. It starts growing too fast, doesn't stop when it should, and doesn't follow any rules. It becomes a cancer cell and begins building an army. It can form a lump called a tumor or sneak into your blood and travel to other parts of the body. That's what makes cancer dangerous. It grows when it shouldn't and spreads like wildfire. What is oncology? Oncology is the branch of clinical medicine that studies cancer, how it starts, grows, spreads, and most importantly, how we can stop it. Doctors who specialize in this are called oncologists. They use tests, treatments, and science to find cancer early, diagnosis, name its type and stage, what kind, how far it has spread. Treat it using medicine, surgery, radiation, or new technology. Support patients through their recovery journey. Main topics in oncology, what students learn. When students study oncology, they learn types of cancer, like breast cancer, lung cancer, blood cancer, leukemia, and skin cancer, melanoma. Cancer biology, how normal cells become cancerous and what genes are involved. Diagnosis methods like biopsies, blood tests, CT scans, and MRIs. Treatment options including chemotherapy, radiation therapy, surgery, immunotherapy, and targeted therapy. Palliative care, helping patients feel better when a cure isn't possible, focusing on comfort and quality of life. How is oncology used in real hospitals and research? Imagine this. A young woman finds a lump in her breast. She visits the hospital, the oncologist orders a biopsy, and the lab confirms it's cancer. What happens next? A team of doctors, surgeons, radiologists, nurses, plan her treatment. She receives chemotherapy to shrink the tumor. A surgeon removes it safely. Then she's given targeted therapy to stop the cancer from returning. Meanwhile, researchers in a lab are testing new cancer drugs that may one day cure cancers without side effects. Some are even using AI and genomics to design custom treatments based on a person's genes. Why is this subject so important? Cancer is the second leading cause of death worldwide. Nearly 1 in 6 people will face it in their lifetime, whether as a patient or through someone they love. But thanks to oncology, millions are surviving and living longer. Childhood cancer deaths are dropping. Hope is rising because we're learning more every year. This subject is the beating heart of many modern medical breakthroughs. Learning about oncology is not just for doctors. It's for future healers, curious learners, and even innovators who might invent a cure. So whether you want to understand science, help a family member, or one day save lives, oncology is a field that mixes courage, science, and compassion. Stick with us in this journey through medicine and health sciences. There's so much more to explore, and you could be the one who writes the next chapter in the fight against cancer.